coming. Can everyone hear me, or do you prefer the microphone? Okay. Is this better? Okay. So my name is Tracy Dunn. To introduce myself, I work for the Office of the State Comptroller in Hartford, Connecticut. We administer the state employee health plan for active employees as well as state retirees. We implement legislative initiatives, which the Connecticut Partnership Plan is part of. So, legislature opened up our state employee health plan and retiree plan to municipalities and boards of ed in the state of Connecticut at a pooled rate. So what that means is you're joining our group of over 200,000 participants. So that offers you rate stability, and we offer a very rich benefit program still. Also, because of the medical carrier, our pharmacy carrier, and our wellness program vendor or administrator offers a dedicated customer as resources and a dedicated account management team. You have access to myself and my staff at the Office of the State Comptroller should you have any issues with the plan, questions, anything such as that. So we are bringing on about 28 new groups for this July. We have probably close to 80 groups now on the partnership plan. Folks really like this plan. It's the same plan that state employees have. It's very rich, and I think you will like it. So with that, I am going to turn it over to Shannon Zielinski. She's from United Healthcare Oxford. She's going to go through the medical benefits with you.
Good afternoon, everyone. So I'm going to be going over, there's a presentation in your packet that's a 12-page presentation that says Partnership Plan 2.0 in the upper left-hand corner and United Healthcare Oxford in the upper right-hand corner. So as Tracy mentioned, you guys will be effective with us as of July 1st. Something to keep in mind, you will be getting ID cards in the mail from us. They do come in plain white envelopes, so please be sure to check your mail. Do not throw anything out. Make sure you do open your mail, and you will get one ID card per person on the plan. So if you do have children on the plan, they will get an ID card as well. This particular plan, as Tracy mentioned, is the same plan as the state population has as well. It is a very rich plan design. It is a non-referral plan design, so there's no referral required from your primary care physician to see any in-network specialist. There is 100% in-network preventative care coverage, so anytime you go for your preventative care, including your immunizations and vaccines, that is covered at 100% as well. They also have coverage for naturopathic physicians on this plan, chiropractors, and acupuncturists. And there's a very extensive local and national network, which we'll go into detail on how that all works for you. And then there's the health enhancement program component, which is the wellness component. And we do have Francine here from Care Management Solutions, and she will go over how that all works for you. So page 2 and 3 go over some of the benefits. These, by far, are not all of the benefits covered under the plan, but these are the ones that we do get the most questions on when doing these types of presentations. You will notice that there are two columns. There's an in-network coverage column and an out-of-network coverage column. So your in-network coverage column is the column you're going to look at when using a participating provider or a provider that is contracted with us. Out-of-network would be a provider who does not contract with us or is what they call non-participating. So as I mentioned, your preventative care is covered at 100% if you stay in-network. Your primary care physician and specialist sick visits are either going to be a $0 cost share or a $15 cost share, and we will explain how you determine which cost share that would fall under. Naturopathic physicians are also covered under the plan with a $15 copay in-network. Emergency room care is covered at a $250 emergency room copay. Now keep in mind, if you are admitted due to that emergency, that copay will be waived. The State of Connecticut Partnership Plan also instituted something called the emergency room copay waiver form. So if it is a true medical emergency, if there was no alternative level of care, or if your primary care physician or one of your providers had sent you to the emergency room, what you would do is fill out that form. You would send that back to Oxford, and we will reprocess it to waive that copay for you. So you would not have that $250 responsibility. Urgent care clinics are also covered, or walk-in centers, in network with a $15 copay. You do have coverage under the medical plan for a routine vision exam, including a refraction, once every calendar year. And that benefit would be either a zero cost share or a $15. Infertility services are also covered. Infertility services done in the office actually have a $15 copay. If it is an inpatient or outpatient hospital procedure, it is covered at no cost. Outpatient physical therapy and occupational therapy, just to point out, there is a difference whether you stay in network with one of our participating physicians or if you go out of network to a non-participating physician. If you stay in network, the visits for outpatient physical and occupational therapy are covered at no cost, and there's an unlimited visit. It does require prior authorization, so medical necessity review is done on those visits. It does cover short-term rehabilitation and not long-term, so just be aware of that. If you decide to go to an out-of-network provider for those services, there is a 30-visit limit per member per calendar year, so just be aware of that difference. Speech therapy is also covered under the plan. It is covered in network at no cost, and also with no visit limit if it does fall under the diagnoses that are outlined in the summary plan description. Those are autism, stroke, tumor removal, congenital anomalies, and injuries. So if your speech therapy is a result of one of those conditions, the coverage is at no limit and no copay. They also do cover any other doctor-prescribed speech therapy. That type of speech therapy would require an authorization and would be covered up to 30 visits per member per calendar year. Acupuncture is also covered, as I mentioned earlier. They do cover acupuncture for 20 visits per member per calendar year. It is a combined in and out of network maximum, so if your acupuncturist is participating or non-participating, all of the visits would apply to that 20 visit limit. Durable medical equipment and foot orthotics are also covered in network under the plan at 100%. With that, durable medical equipment, just so you're aware, is anything that withstands repeated use and is used in the home, such as CPAP machines, nebulizers, crutches, canes, wheelchairs, anything to that nature. Nutritional counseling is also covered at no cost for 3 visits per member per calendar year. And on the bottom of page 3, it does go over what the actual out-of-network benefits are. So if you go to an out-of-network provider, it's a $300 individual deductible, family of $900. Once that deductible is met, Oxford would pay 80% of the allowed amount. You'd be responsible for 20%, and then any difference between the billed and allowed charges if there are any. Keep in mind when using an out-of-network provider that they actually do not have a contract with us, so they are able to bill whatever they want. So it could be a little bit costly if you do go to an out-of-network physician. There's also an out-of-network, out-of-pocket maximum of $2,300 per individual and $4,900 family. So if you do meet that, what actually applies to that is the deductible and your 20% coinsurance that you'll be paying to those out-of-network providers. So if you do happen to meet that $2,300 per individual or $4,900 family, Oxford would then pay at 100% of the allowed amount, and you'd only be responsible for a difference if there was one. As I mentioned earlier, this is not all of the benefits. The state of Connecticut is a self-funded plan, so they do have something called a summary plan description, which is available on our website, which we will go over at the end of the presentation, and also on the comptroller's website as well. That is a full 106-page document of everything that's covered from soup to nuts. So if you wanted to look into, everything that's covered under the plan, you most certainly can do that as well. So page 4 goes over something called the tiered primary care physician and specialist copays. So if you're using a preferred primary care physician, or a specialist in one of the 10 specialties that is listed on page 4. And that provider is in the state of Connecticut only. And they actually have a listing on our website of 2 blue hearts. So they have a designation of 2 blue hearts right on our website next to their name. What that indicates is that is a high quality, cost efficient provider. And anytime you saw that provider, it would be a zero cost to you. If the provider is listed on our website, but maybe they have not 2 hearts, but they have 1 heart or they have no hearts, you most certainly can still use that provider. It would just be at your $15 copay. So that's the difference of whether it would be a 0 or a 15. If the provider is a specialist that's not one of this particular list, and the provider is participating, it's still just your $15 copay. There is an asterisk next to the ophthalmology specialty. On our website, what we did is we actually put a PDF copy of a listing of preferred ophthalmologists. At the end of the presentation, I'll give you the website as well. You just go on the website. It is a dedicated website for the partnership plan group. You can click on the top. There's just some tabs at the top. You're going to click the benefit tab, then find a provider. And then when you scroll down, all of this information is there as well, so you don't have to worry about if you ever lose this paper. We do explain all of this right on that page. And there is a link right on, if you click the word ophthalmology, it'll populate the listing of preferred providers for ophthalmology for you. If you do go out of network to an out-of-network or non-participating provider, this tiered structure doesn't apply because that would just fall to your out-of-network benefits of the deductible and coinsurance. So page 5 and 6 go over the network of physicians. The local network is called the Oxford Freedom Network. That network is Connecticut, New Jersey, and the 5 boroughs of New York, of Manhattan and New York. If you're within that tri-state service area, you're going to use the Oxford Freedom Network. All of your services would be covered in network for those providers. There is as I mentioned, the website. You can find the listing of providers, so you can either go right on this website here. There's step-by-step instructions on how to find a provider. You most certainly can call customer service. They can actually send you a listing either by fax, by email, or by regular mail. But if you'd like to do it yourself, we do put the website here with the instructions on how to do so. If you are going outside of that service area, so outside of the Oxford Freedom Network area, you do have national access through United Healthcare's Choice Plus national network. So that network covers the remainder of the United States. It covers the U.S. territories and Puerto Rico as well. So if you were to go on the website and look up a United Healthcare Choice Plus provider, that provider that you find on that website is also considered in-network for you. So if you have college students that might be outside of the Oxford service area, or if you're away on vacation and you most certainly can do so, and you'll still have access in-network for those services. So all of your in-network benefits would actually apply. Page 7 goes over the clinical programs offered to all of the State of Connecticut Partnership Plan members. There is another handout in your packet of a lot of information. I know we put those together, so there's quite a bit of information in there. At the top, it's actually titled State of Connecticut Partnership Plan Health, Wellness, and Case Management Programs through United Healthcare Oxford. That is a full listing of every one of these programs here, but it gives you an actual description of what the program offers, and it gives you phone numbers on how to get in touch with a nurse that would be able to help you with one of these programs. So if you or any of your family members may benefit from one of the programs, once you become effective as of July 1st, you can give the phone number a call, and they can actually help you with enrolling in the program or give you some educational material or anything you may need relative to that particular program. One that we do like to point out is the Oxford On-Call Nurse Line. It is a 24-hour, 7-day-a-week, 365-day-a-year nurse line. So if you need to speak with a nurse at any time, the number will be on the back of the ID card, so you most certainly can call that number at any time. But maybe if you can't get a hold of your provider, you most certainly can call the nurse line. Page 8 goes over something called the Site of Service Program for lab and diagnostic radiology. And this program is for lab and diagnostic radiology services that are within the state of Connecticut as well as Westchester County, New York. I'm not sure if a lot of folks will be traveling to Westchester County, New York anytime soon, but just keep in mind that this program does apply there as well. So what this program is we do have a preferred list of both radiology and labs that are what they consider preferred. So if you determine or go to one of those participating preferred providers for both lab or radiology services, including your high-cost diagnostics, so your MRIs, your CAT scans, bone density scans, PET scans, you would have no cost. So it would be a zero cost share for you. Something to keep in mind, mammograms do not apply to this program at all. So if you're having a mammogram done or a breast ultrasound that you may need in addition to the mammogram, you can go to any participating provider and have that covered at no cost to you. We do also cover the 3D mammograms if women are interested in that as well. Also keep in mind, if your provider has the ability to perform these services in their office, so if you go to an orthopedic surgeon and maybe they have an x-ray machine we're not going to expect you to leave that office and go somewhere else to get your x-ray done. You have it done there, it's all part of your office visit, and you would just have your copay, or if it's not one of the providers, if it is, then it would be a zero cost. For labs, it is Quest is our participating and preferred labs. There are also some other smaller labs on the list as well. If you are having an outpatient procedure at a hospital or an inpatient procedure at a hospital, or you're in an emergency room setting, this does not apply either. So you don't have to worry about that as well. If you're having services done, just have all of your services done there and it's covered as part of that procedure. You don't have to leave. We don't want you going across with a little Johnny coat on across the street to try and get your lab work done, your x-ray done. It wouldn't work. It doesn't work. If you do decide to use one of our participating providers that's not on the preferred list, it's okay, you can still do that, but it does incur a 20% in-network cost share. They also have what's called a site of service waiver form. So we don't want to deter people from having appropriate care when they absolutely need to. And also there are some exceptions to that program, to this program as well. So if you have a cancer diagnosis, this program does not apply. If you have children under the age of 10, or if you have a pregnancy diagnosis, there are some things that you have to have done only at a particular hospital or facility because they're the only ones that may do that type of service. In those instances, they have a waiver form that will actually, if you do get charged that 20% in-network coinsurance, you can fill out the form and have that waived as well. So there is that option there. If you do go to an out-of-network provider, now normally the out-of-network coinsurance is a 20% coinsurance. For lab and radiology, if you're going out-of-network, the coinsurance does go up to a 40% coinsurance. But again, it's only if the provider is not participating. So page 9 goes over something called prior authorization. So this is services that require prior authorization in advance, and if you're using a participating provider, it is the provider's responsibility to obtain that authorization for you. So you do not have to worry about this list. They would contact Oxford, have the authorization put on file for you. If for any reason they fail to do that and you still have the service done, the claim will come to us and we will actually deny the service, but we will deny it to the provider. So if you do receive a bill, please do not pay that bill. Give our customer service number a call. If it is not your responsibility to pay, they will actually reach out to the provider by letter. You will get a copy of that letter letting them know they can't bill you for it. They actually will have to write it off per their contract with us. They need to get the authorization, and they usually know that. So they will have to write it off. If you're using an out-of-network doctor, however, the onus does fall on the patient to make sure that the authorization is in place. Being that they don't have contracts with us, we have no bearing over what they do. You most certainly can call yourself to start the authorization. If your out-of-network doctor is willing to call for you, we most certainly will take that authorization from them over the phone. But if they don't do that, it is the patient's responsibility to make sure that authorization is on file. If it's not and the claim comes in, it will process and deny to the patient's responsibility. So just keep that in mind if you're using an out-of-network doctor. Also, any authorizations that you currently have with your current carrier will not transfer over to us. We have no way of getting that information from them. So if you come onto the plan as of July 1st and you have something that requires an authorization, your provider will have to call in a new one with us. So page 10 goes over something called transition of care. And transition of care is basically a process in which a member may be allowed access to an out-of-network doctor on an in-network basis to continue a course of treatment for a transitional period of up to 60 days. So if you have a life-threatening disease or condition or a disabling disease or condition, or a woman in their second or third trimester of pregnancy, what your out-of-network doctor would do is they would contact us as of July 1st. We would send them an actual transition of care form. They would fill that out, send it back to us, and we would put an authorization on file to allow you to see that doctor on an in-network basis for 60 days from the date of the plan. The reason for that is it basically takes off some of the financial burden for you of transitioning to a new plan to either allow you to change providers if you choose to. Otherwise, you do have the option to use your out-of-network benefits. If you have any providers that maybe are not participating with us and you would want us to reach out to them, we most certainly can do that as well. We can reach out to providers that are not participating, see if they would be interested. We have had a lot of success with the growth of the partnership group, bringing on a lot of doctors, extra doctors that have maybe not participated with us, but because of the growth of the partnership plan, they've decided to join. So we definitely would reach out to them if you have any providers that you would want us to reach out to. Lastly, page 11 and 12 go over all of the contact information. So there is a phone number here that says prior to the effective date. So if you happen to leave here and there's a question you forgot to ask, you can give that phone number a call. Just let them know that you're coming onto the plan with either the town, because I know there's a couple people from the town, or the Board of Ed of Ledyard through the partnership plan with the state of Connecticut, and they can answer any questions you have specific to this plan. Once you are effective, the 1-800-385-9055 is the number that will be on the back of the ID card. So that's the number to the dedicated state of Connecticut call center that they're going to answer all the calls related to your benefits, claims, or anything you have questions on. The website that I mentioned, the partnership, stateofconnecticut.welcometoUHC.com. This is a great website that we specifically created for the partnership plan groups. This is the one where I mentioned if you go on the tabs at the top and just click the benefit tab, find a provider, it does go into detail on how to find providers. It goes over also the site of service program in case you lose this number. You don't have to ever worry about that. And it also has links to the list and then links to both the Oxford Freedom Network provider lookup and the Choice Plus provider lookup. So it's a lot of information in one place. We also have under the additional links tab, or additional information tab, I should say, we also have links to the different vendors' websites. So we have the State of Connecticut's website link there. We have Care Management Solutions website there, the CVS Caremark website, and then also the Health Enhancement Program websites. We have all of them listed there, so you can kind of like one-stop shop. We also have the emergency room copay waiver form there, the site of service waiver form, and also the summary plan description that I mentioned earlier. That's 106 pages that we put on our website as well. So there's a wealth of information out there for you. The Oxford Secure member portal, so oxfordhealth.com, that's the website you would use if you were interested in going on and registering with a username and password, because that will give you access to your own personal information, so all of your own personal benefit and claim information. You would have to register with a username and password. All of the other websites are public, so you can just go on at any time without a username or password. There's also a behavioral health website, so if you need to locate a behavioral health provider, you most certainly can do so. You can actually search on that website based on the level of the clinician, whether they treat adolescents or children, and you could also search by treatment options that they offer as well. It's a really great website for that. And the last two websites, the first one is our medical policies, so those are also public information if you wanted to look on how something is covered. They are listed in alphabetical order. There's quite a few out there, but if you wanted to just, for an example, if you wanted to look at how bariatric surgery was covered and what clinical information is required to get that authorization, you can go ahead and on that website and pull those policies up. And the last website is the State of Connecticut Comptroller's website. We do list that for you as well. A lot of the same information that we have on ours, you can get on their website as well. So there's multiple places where you can get a lot of the same information. In your packet, you also have other pieces of paper that go over discount programs. One is called Healthy Bonus. The other one is United Health Allies. And both of the programs are great. I personally think the United Health Allies one is a little bit more robust. Basically, what they do is discounts on things that are not normally covered as medical benefits. So things like teeth whitening or massage therapy or LASIK eye surgery, gym memberships, memberships to Curve, Jenny Craig, Nutrisystem. They offer some discounts. So what you can do when you become effective is you can go online, register with them. They'll actually send you a little white card with a ID number, and you can go on their website and pull up your zip code area and what type of discount you're looking for, and it will list all the vendors that offer discounts and what those discounts are. So you could kind of pick and choose which one you want to go with. So that is my spiel. I am going to turn it over to Francine from Care Management Solutions. We are going to hold questions till the end, and we will take all the questions that you have, but we'll just get through this portion and then we'll move on.
Good afternoon. My name is Francine Brockie, and I'm from a company called Care Management Solutions. We manage the health enhancement program for the state of Connecticut and the municipalities who join the partnership. So today I'm going to talk about the program, and there is a document in your packet of information, listed health enhancement program. If you could pull that out, it's a double-sided document, and we're going to go over the information on the front of the page as well as the back of the page. So the health enhancement program is designed to positively impact the overall health of its participants through two components: preventive requirements and education and counseling for chronic conditions. So the first part we're going to go over today are the preventive requirements, and I'm going to ask that you turn to the second page, which contains a grid. I'm going to show you how to use this grid. All of the preventive requirements of the program are listed along the left-hand side of the page, and at the top of the page are age bands. How you would use this grid is determine your age band on January 1 of 2019, and then you would go down the list, the column, to see what requirements you need to complete and the timing associated with those. So for purposes of this particular discussion, we're going to concentrate on the 50-plus column. If you are 50 years old on January 1 of 2019, you will need to have a preventive visit. That's your physical. You would need a vision examination, and that is broken out separately. If you're between 50 and 64, it's every 3 years. If you're 65 plus, it's every 2 years. You need an annual dental cleaning, as well as a cholesterol screening every 2 years for compliance. If you're a female, you would need a cervical cancer screening up to age 65. And then the last screening is the colorectal cancer screening, which can be completed 3 different ways. You can either have a colonoscopy, which will update the requirement for 10 years from the date you have it. You can have an annual fecal occult blood test when you go for your physical, or the latest test is the Cologuard, which will update the requirement for 3 years from the date you have it, and that's a DNA test. What I'd like to also point out is this grid is a representation of your minimum requirements to stay compliant with the program. It's not a reflection of your insurance benefits. So next we're going to discuss the second component of the program, which is education and counseling for the following chronic conditions: diabetes, both type 1 and 2, asthma or COPD, which is chronic obstructive pulmonary disorder, heart disease, heart failure, hypolipidemia, which is high cholesterol, and hypertension, which is high blood pressure. So if you have any one of these chronic conditions, you need to complete yearly education and counseling, and it's very simple to do. If you choose to register for the portal, you can complete it right online, or you can call our customer service center and do it over the phone with either a nurse, case manager, or with a customer service associate. The one thing I want to point out is if you are hospitalized for any of the chronic conditions, you may receive a call from one of our nurse case managers. You are required to take the initial call, but then you can decide if you would like to be case managed after that. So there are advantages of staying compliant with the program, and I'm going to go over those next. Those include lower premium payments and lower out-of-pocket costs. For those that are non-compliant with the program, they pay an additional $100 a month for their medical insurance, and then there's an in-network deductible of $350 per covered person on your plan that maxes out at $1,400 for your family. Office visits related to the chronic conditions have zero copayment, as well as your prescriptions to treat these medications are available at a lower to zero to lower copayment. The calendar year is how we determine your compliance, and because you're joining mid-year, your annual HEP evaluation period will be December 31st, 2019. That's when you and your family will need to be compliant with the requirements of the program. How we receive proof that you've completed the requirements are through paid claims. So we receive on a weekly basis all the claims from the carriers, and that will feed down to your record and update your compliance in the portal. For those of you that have completed the requirements that are listed on the back page within the timing allowed, you can use a physician's notification form to update the requirement rather than completing it again. And all of our forms are available online. So we would encourage you to check your portal. You will receive email notifications periodically throughout the year to check your compliance with the program. As well, starting in September of 2019, if you are missing requirements, you'll receive a letter from Care Management Solutions indicating the requirement is still missing and you have until December 31st to complete it. Our contact information is located at the bottom of the page. Our website is listed, the cthep.com. Each person that is enrolled in the insurance over the age of 18 can log into the portal and create their own account to follow their compliance. You just need the last 4 digits of the employee or retiree social security number to do that. We also offer exemptions for those that cannot complete the requirements. An example would be if you are currently undergoing treatment for cancer and cannot have a dental cleaning, you can have a waiver for that particular benefit year. You would use a copy of the physician's notification form, bring it to your provider. They can sign off a temporary exemption for you for that calendar year. The physician's notification form is also used for permanent exemptions. So if you have full dentures and no longer need a dental cleaning, you can submit that form to us, and then we will remove that particular requirement from your portal permanently going forward. I just want to highlight that at the bottom of the page, we have our 877 number. It's 1-877-687-1448. That's our customer service unit, and they're available Monday through Thursday from 8 to 6 and Friday from 8 to 5. In addition, we've also listed our fax number as well as our email address, which is hepquestions@connectyourhealth.com. So with that being said, I'm going to turn it back over to Tracy. Thank you.
Okay, I am going to be explaining to you our pharmacy program. So if you look in your glossy book on page 5, I will just go through all this information with you. So our pharmacy benefit manager is CVS Caremark. They pay all claims on behalf of our pharmacy plan. So you will receive a CVS Caremark card in addition to your medical. We copay structure. So we have 2 tiers of generic, preferred brand, and non-preferred brand. Also, we break out the structure between acute medications or non-medications, which are medications you take for less than 30 days, such as an antibiotic or something like that. Maintenance are something you take every day. We require you to get those in a 90-day supply. In addition to those, there's the drugs to treat the HEP conditions that Francine had just gone over, those drugs are also considered maintenance drugs, and those have a slightly lower copay schedule. That's a 3-tier, and those tiers are 0, 5, 12, 50 for the HEP. For any other maintenance drug or non-maintenance drug, it's 5, 10, 25, 40 for each tier. For maintenance drugs, we do require that you obtain your prescriptions at a maintenance drug network or mail order pharmacy. What that means is if you're using mail order today, meaning you get your drugs shipped to you from a mail order pharmacy, you can continue to do so through CVS Caremark. You would just call them. Their number is on the back page of this book, and ask them to contact your current pharmacy manager to transfer your scripts. Or you can use any maintenance drug retail pharmacy. So in the state of Connecticut, we have a maintenance drug network. It includes all CVS pharmacies, as well as Stop and Shop, Big Y, Target, Walmart, Price Chopper, and some other smaller pharmacies as well. You can pick up your maintenance drugs at any of those pharmacies. You're just required to get the 90-day supply. If your doctor writes you a script for a 30-day supply, you have one fill at 30, and then the next script would have to be at 90. We do have a mandatory generic component to the program, meaning if you're taking a drug that has an exact 1-to-1 generic match, the pharmacy will substitute the generic. If your provider does not want you to take the generic, they would fill out what we refer to as a coverage exception request form, where you are able to get the brand name drug for certain reasons. And that's if you're allergic to a filler or you've tried the generic and so forth. So there is an exception process for that. In addition, we follow CVS Caremark standard formulary, which, just so you know, the formulary can change quarterly. If you are ever impacted by a change, you would be notified by letter. And what I can tell you about this is your prescribers are very aware of the CVS Caremark formulary in the state. Even outside the state, are very familiar with these formularies. If you happen to take a drug that is not on the formulary, we also have an exception for that. So if you need a drug that's not preferred by CVS Caremark and therefore not on their formulary, but you have a medical reason for taking it, there is a form your provider can fill out, submit to Caremark, and they will review it for medical necessity. And again, just a reminder that those HEP chronic condition drugs are at low copays. So if you're taking a generic to treat high blood pressure, you actually pay nothing for those drugs. Now I will turn it over to Jeannie. She's our representative from Caremark. I'm sorry. It's been a long day. From Cigna, she's going to go over the dental and vision benefits, and then we'll take all questions. Oh, yeah. Sorry. That's the microphone? No. Oh, yeah.
Good afternoon, everybody. I'm Jeannie from Cigna, and I'll be going over the presentation that you all should have received when you came in, and regarding your dental plan options and also vision. But I'm going to do a relatively high-level overview of these benefits, and I just want to point you to the 2 benefit summaries that you also have in your kits that go into a lot more detail about the dental plan as well as the vision plan. So for your dental plan, you'll have access to Cigna's dental PPO plan of providers, and you can find that information on the State of Connecticut Partnership site if you want to find out if your dentists are participating. We do offer you a lot of flexibility with this plan because you have the opportunity to utilize dentists who are participating in the network and take advantage of the discounted arrangement we have with those dentists, or you can go out of network if you decide to and still have the same coinsurance levels. It's just that we'll process the claims based on the maximum reimbursable charge.
So you could potentially have a little bit of additional payment that you would have to give to the dentist. But we have a fabulous network in Connecticut, so hopefully most of you will find your dentist in the network. So with the dental preferred provider organization, you do not need a referral to specialists. So if you feel the need to see a particular type of dental specialist, go ahead and go see them. And again, just make sure they're in network if you want that to be assured that you don't have balanced billing. So I am on page 5 right now, and I'll just go over real quick the coverage. So with your plan, you'll have a calendar year deductible of $25 for an individual and up to $75 for a family. So if you have more than 3 people in your family, you're capped at that $75. And that is the calendar year deductible. Your calendar year maximum, so that's your benefit maximum, is $1,000 per person, and Class 1 services do apply to this. However, there is no calendar year maximum for periodontal maintenance, scaling, and root planing. I know a lot of people take advantage of that service, so it's nice that you don't have a maximum for that. For exams, cleanings, and x-rays, covered at 100% in-network, and you'll see the same thing out-of-network, covered at 100%, but remember, we'll be basing our payment to the provider based on the maximum allowable charge, so you could potentially pay a little bit extra if you go out-of-network for that cleaning. Periodontal services, minor and major, are covered at 50%, both in and out of network. Simple restorations, such as fillings, are covered at 80%, both in and out of network. Oral surgery, minor surgery, is covered at 80% in and out, and major at 50% in and out. And again, your benefit summaries that you have in your hands go into more detail on the benefits. Major restorations, such as crowns, are covered at 50%. Orthodontia is covered for employees and their dependents, so adults as well as children. And there's a lifetime benefit of $1,500 for this. It's covered 50% up to a maximum of that $1,500, both in and out of network. So those are your benefits for dental in a nutshell. So let's move on to vision, unless anybody has any questions on the dental. Okay, yes. You have 2 cleanings per year. Yep. On your benefit summary, you'll see the details on that. Okay. So for vision, again, you have that benefit summary in your hands. So vision is using the Cigna Vision Network, and this is for routine eye care. Obviously, I need eye care. So for routine eye care, so you just need to go find out if you need a prescription for glasses or contacts. So materials copay, if you utilize the doctors or eye doctors that are in the network, there's no materials copay. So for lenses, single vision lenses, those are covered in full in network. So as are the bifocal and trifocal and lenticular lenses. Those are all covered in full in network. If you go out of network and you use a provider that's not in the Cigna Vision network, there's an allowance. So Cigna will pay up to, for example, $40 allowance for the Cigna single vision lenses, $65 allowance for the bifocal, $75 allowance for trifocal, and $100 allowance for lenticular. Contact lenses are available as well. They're covered under this plan. For elective, there's an allowance in network of $360, and out of network, the allowance is $345. If it's therapeutic, they're covered in full, and out of network would be $345 allowance for therapeutic. And just so you know, the glasses and contacts, you can have one or the other at a frequency of once every year. So you can't have both. It's just one per year. The frame retail allowance is $175 in network and $126 allowance out of network. Okay. So when you are going to your Cigna Vision provider, you want to just make sure that they're in the Cigna Vision network, just to make sure you get the best benefit, and just let them know that you're with Cigna Vision. Okay. There are additional benefits to using a Cigna Vision provider as well. So if, for example, you need to have progressive lenses, those would be covered up to, I believe, a certain amount, but then anything above that, if their cost more than that, then you would get a discount of 20%. So there's some other services like that that are available. So a little bit more, going back to dental, I just want to talk a little bit about a program that we have. It's called the Brighter Technology. And this is giving you access to more information about the dentists who are in our network. And this gives you a Brighter score, which gives you basically a score that you can compare dentists and based on affordability and patient experience and professional history. Also, with the Brighter Technology, you can see reviews from people who have gone to that dentist, so that might help you decide whether you want to go to that dentist or not. And also, some of them have online appointment booking available online, so that might make your life easier to do an appointment booking online rather than calling. And also, there is cost estimates available through this technology. So if you're looking to see how much a certain procedure might cost, it will give you an estimate as to what the cost would be for that particular service based on your plan. And we do have a Cigna mobile app, so most everybody has smartphones these days, so if you'd like to download or upload, whatever the terminology is, the Cigna app onto your smartphone, and you'll have access to all this information right there in the palm of your hand. The next page, which is page 9, is the information about the Cigna Dental Oral Health Integration Program. And Cigna put this program together because we know that there's a lot of research that's been done that says that your oral health really has a huge impact over your overall health. So we want people with certain diseases to be able to have access to additional services. So if you look at this, the page 9 here, you can see that if you have heart disease, maybe a stroke, diabetes, on a more positive note, if you're pregnant, or if you had chronic kidney disease, organ transplants, or head and neck cancer radiation, then you may be able to get additional services through the program. So there's information on this on mycigna.com, and I'll talk about that site in just a moment. By being a Cigna member, just by having the Cigna Dental or Vision, you have access to discounts through our Healthy Rewards program. So this gives you discounts on such things as massage therapy, acupuncture, hearing aids, lots of information out there, gym discounts, and so forth. So just so you know that that information is available on mycigna.com. And since we're talking about mycigna.com, on page 12, this is how to access us. So once you become part of Cigna, as of July 1st, you can reach us 24/7, any time of day or night, on a holiday, on a weekend, whatever. Feel free to reach us by phone and ask your questions. But you also will have access to mycigna.com, which is a personalized website that you can register for, create a username and password, and then you'll have access to all of your information and the tools that I told you about online. And that's where you'll find that Healthy Rewards information, the cost estimation tools, and so forth. And also on this page, you'll see the partnership site, the website that you can go to find out if your dentist is participating. And on the next page is the online oral health assessment. So basically on that mycigna.com website, we do have these types of assessments out there to help you identify your cavity risk or also your gum disease risk. And we also have information, a little test you can take to find out how educated you are on oral cancer. So all of that, again, is on that mycigna.com website. And that pretty much wraps it up. Yes? Oh, we can get through those. Yes. Sorry about that. Does anybody else have any other questions? Yes. Okay. Okay, so the question is, if you have a child that's already in braces and they're coming over to Cigna, will they need a referral to see the orthodontist, or will there be coverage for the orthodontia? Basically what happens is, if you come over to Cigna, then it will be prorated, so based on where they are in their treatment, It'll be prorated, and then again, determining whether you're in or out of network. But again, your benefit is the same, up to $1,500. So we'll pay up to $1,500 based on how it's prorated. You're welcome. I think you had a question here. Is it 26?
What do you cover today? Is it 26 today? That would be, we allow your HR department to determine that based on what you currently have. Do you know what the dependent age for dental is? Okay, so that will remain the same likely.
So dependent.
Yeah.
Okay, the question was how long are dependents eligible to be on the plan? And we're thinking it's 25 based on the way it is today. And if that's the way it is today, that's how it will be going forward.
Yep.
Yes.
The benefits that run on calendar year, we're starting our plan in July. And then are all those benefits going to reset in January, even though we're only on a half year? How does that work? Do we get a whole year's worth of benefits in half a year?
Yep.
And then January, we start from scratch?
Right now, in July, you're going to start fresh with a new benefit maximum. And then that will go till the end of the year. So you'll have another $1,000 of benefit starting July 1st till the end of this year. And then you'll start over in January. Yeah. So actually, it's a good benefit.
Because the income has us till 25, but since this is a whole new dental plan, can we get it up to for our children to the age of 26? Or is it predetermined?
I can bring that back to Cigna.
Yeah, that's
Yeah,
what
I'll
I
bring it back to Cigna and have them discuss it with your.
Because we do have children that are, if there are 25 possibly might be during this changeover, and so parents that are signing up, then all of a sudden the children don't have that. That's my opinion.
Okay. Oh, definitely. Well, we definitely can take that back, and I know a lot of companies do cover till age 26, so we'll definitely bring that back, and we'll have.
Will it be like to the end of the month with the turn 26?
Again, it's however it's set up with you guys now, and we can bring that back and set it up the way it needs to be set up. Sure, absolutely. Let's see, who's next? Okay. Yes.
The question was, how do you submit proof that you've completed a timing enhancement program? What you can do is you can print off a physician's notification form online. If you don't have access to online, you can call one out to you. Bring the form to your primary care physician if he received results of your colorectal cancer screening. Have him sign the form and send it in. A colonoscopy is good for 10 years from the date you had it. The reason why it's not going to update in your portal without sending in the form is we don't have access to the claim information prior to July 1st.
Yes.
Okay, so there's two classifications. For your 30-day acute non-maintenance drugs, so those drugs that you would get in 30-day supply, you can use any pharmacy in CVS Caremark's network, which is basically every pharmacy in the state of Connecticut, including Rite Aid, Walgreens, all the small pharmacies. Exactly. If you are getting maintenance drugs, you must use the maintenance drug network, which includes CVS pharmacies, Stop and Shop, Big Y. It does not include Rite Aid or Walgreens. So you would not be able to fill your maintenance drugs at a Rite Aid or Walgreens. Go ahead. Yes, so you can choose to use the CVS Caremark mail order pharmacy where that you would enroll with them and the drugs would get shipped directly to your home. Correct. Okay, go.
So the question was, is there a cap on acupuncture? Are you talking in dollar amounts or a visit limit? The visit limit is 20. You will just pay, there is no cap. It's basically if you're using a participating acupuncturist, we're going to pay their contracted rate to them. You're going to pay just your $15 copay. If you use an out-of-network acupuncturist, it's going to be based on usual and customary rates that they'll pay for the procedure that they bill, and it all depends on what code they bill. And then in that instance, you would pay your deductible and your coinsurance for out-of-network. So it's a little bit different depending on which one, but there's no actual cap. Yes? What about?
I think that I saw something that said out-of-network there was a limit of 30.
Correct.
What about
Yep, in-network for chiropractic care also is covered at no cost if you use a participating chiropractor. Not in-network. There is no annual limit in-network. Out-of-network is that 30-visit limit. Yes.
So when I heard about the change, I began to call my offices to find out if they accepted the insurance.
Yep.
I did find discrepancies between what was listed on the website and the actual office manager. And where I really stumbled is exactly what to call it.
Yep. Thank you for actually bringing that up. That's a great point. Yep.
The medical and the dental vision so that when I call up on Monday,
Yep.
I know.
I can do the medical part. So the question is, when you're actually calling your physicians and you want to see if they participate with the medical insurance, what you're going to ask them is if they participate in the Oxford Freedom Network. That's the actual network, the local network of the Connecticut, New Jersey, and the 5 boroughs of Manhattan and New York. So when you call there, you don't want to say, do you participate with the state plan? Reason being, they usually associate that with a Medicaid or a Husky program, and they'll usually say no, so there could be a discrepancy there. We have found also, if you call your provider's office and you ask them if they're participating, it could be the office staff that sometimes doesn't know. It's unfortunate, but it does happen. You may see them on the website, but they're telling you no. Please let us know that. Give the customer service a call. They can reach out to them and help you and kind of get them to understand, yes, they do participate. And if they don't, and they're still on the website, they haven't told us yet, because they still would have a contract with us if they're on the website. I'm going to give that to Jeannie so she can explain what to call for dental.
For dental, it would be the dental PPO plan. Cigna dental PPO plan. And then for vision, it's the Cigna Vision Network. Dental PPO, Cigna Dental PPO or Cigna DPPO, and the Cigna Vision Network.
So the DPO and the DPPO.
DPPO.
Okay, I'm looking right now at an oral surgery that has DPPO.
That's correct. That would be it. Dental PPO, Dental Preferred Provider Organization. You're welcome. Yes.
I think under our coverage with Anthem Blue Cross Blue Shield, we had 120 paid if we go into a nursing home for 120 days. Do we have any kind of coverage like that now?
So the question was whether or not there's coverage for a convalescent home, also skilled nursing facility where they can do it. Well, I have every benefit, unfortunately, by heart. My suggestion would be to look at the summary plan. almost positive that there is a limit for in-network, either home health care or skilled nursing facilities. You have no limit in-network. Out-of-network, there's a 200 visit limit for network. But in-network, I do not believe there is one, but please just check the summary plan description just to be 100%. I don't want to give you the wrong information. I don't know every benefit by heart. I wish, almost, but not yet. Yes?
Regarding, the maintenance work that is currently paid, which we might maybe get into express scripts, which is what we want to, is that going to be transferred over to Earmark, or what do we do?
So I can probably answer that, even though I'm not the CVS rep, but I've done enough of these to know. So if you have a current mail order prescription through Express Scripts, you can actually call the customer care number through CVS Caremark, and they will contact them to get that script transferred over to CVS Caremark. So you can still keep the same one. After 7/1, yes, I apologize. After July 1st. Yep, yes.
The summary, the detail
Yep.
coverage plan,
Mm-hmm.
is available on the website.
Yes, they're all public information, so you can either go on the comptroller's website, which is on the back of the presentation I did on page 12, or you can go on the partnership website that Oxford created specifically. We have it listed under the additional information tab as well, so you can get it in a couple different places.
Does that hold for the vision and the dental report?
Do you guys have it on yours? Vision and dental, the summaries?
The summary, I don't think so, because this is a custom plan, so we can get those to you. We'll just email them through your HR department, and they can post them on your website or what have you. Yep.
Yes.
So that's an excellent question. So because you're enrolling into the Health Enhancement Program effective 7/1 of 2018, you're all considered HEP compliant for that first 18 months. The first year you and your family will need to be compliant with all the requirements is in December of 2019. The HEP compliant rate, that's correct.
Is affiliated with the Owens Payment Company. I have a physician who does some of her surgery procedures at Western Hospital.
Yes, that's actually covered. But I work in Westerly Hospital with them, so you're fine. You'd be covered in network for all those services. Yes, as long as the doctor is participating with United Healthcare's Choice Plus network, it's all in network coverage for you, even if you're in Massachusetts or Rhode Island or any other state outside. Yes. I didn't bring my crystal ball today. That's you. You want in for that?
Yeah. So over the past 3 to 5 years, our rate increases for the state plan have been on average 5% or less. This year was a little bit higher, but on average it's 5% or less. We've had a couple years at 0, and the reason is we put measures into our plan to try to control costs. So, for example, having people try to go to preferred facilities is saving the plan costs. Because of our size, we're able to negotiate better fees and things such as that. So that's the great thing, because you as a smaller town and Board of Ed are joining such a large group. So we just have a lot of people to spread all the risk out for. So we're really able to maintain our rate stability. You're not going to see double digits, upwards of 25, 30% like you would see out in the commercial market today. Go ahead.
Regarding the vision, I'm curious what
So that's actually a very specific question. Should we take his name and get back to him? Yeah. We'll take your information and get clarity and get back to you on that one. Okay? Any other questions?
I'm retiring from the town,
Mm-hmm.
and I didn't know how could I do the thing out and who I had the calendar for.
Are you going on Cobra? To that, you will be enrolled in Cobra through the town will enroll you, and then you will pay the Cobra administrator, which is of United Healthcare.
So the question was, what about coordination of benefits and how does that work? So basically, when you come on, we're not going to have, if you have another insurance carrier as, just another insurance carrier through a spouse or what have you, we don't have that information to start with. Usually how we get that information is by claims coming in, if they come in submitted with an explanation of benefits or a diagnosis that indicates there may be another carrier. Usually what our coordination of benefits team will do is they'll send out a letter, a coordination of benefits questionnaire, asking if you have other coverage to fill out that form and then send it back to us. We update our system indicating whether or not you have other insurance, and then we do coordinate with other plans if you do have a spouse or if you're on another insurance plan. If you are an active retiree and you have, excuse me, that didn't make any sense. If you are an active member and you are on this particular plan as an active member but have Medicare A or B, that will be your secondary carrier because an active policy will take precedence over a Medicare policy. Did that answer your question? Okay. Yep. Yep. I don't know offhand if South County is. I'm sure it probably is, but I don't know offhand. I do know like most of the larger hospitals, like even in Boston, like Dana-Farber or Brigham Women's, they're all participating, but I'm not 100% sure on that one. So any other questions? Yes.
Retired people have been mailing marketing sterling kept that payment for Anthem. How's that going to work?
That is a question for HR, I would think. They wanted to know, previously they've been sending in their payments to Sterling for retired teachers, and how would that work? Not changing. Any other questions?
That's an excellent question. So the question is, if as a retiree employee you don't participate in the dental but have it separately, how would you submit proof that you've completed it? Once a year you can print off the form and bring it with you when you go for your dental cleaning and have the provider sign off and send it. Dental insurance, when you go for a cleaning, a lot of times you receive an explanation of benefits, and you can fax that to Care Management Solutions. The fax number is listed on the bottom of the page that I handed out. The form I'm referring to is called the Physician's Notification Form, and that's available online, or you can request a copy be mailed out to you if you call customer service.
For this calendar year, I've already had my annual physical. So as far as that compliance thing is concerned, I don't have to worry about that for this year because I'm not going to be responsible for that until
So the question is, do you need to worry about compliance for 2018? And the answer is no. In January 2019, your portal will be reset, is what I'm trying to explain to you. And the 2019 requirements are what you need to complete by December 31st of 2019. As you use the insurance, the claims are going to come through and they will update your portal in 2018, but you don't have to worry about being compliant for 2018. Any additional questions?
I think that's it for this evening. We also, I appreciate you ladies coming by.
It's been great. You've given us a lot of information. And I'm sure I'm going to hear back from some of you for information. And I'll probably be on the website or contacting any of you if there's any other questions that come up that I might not have the answer for. So most of you have my email address. It's troush, R-O-U-S-H, @ledger.net. So contact me anytime, okay? So that's it. We're going to get out of here because the band's going to be this evening. Thank you for coming. Thank you.